Hi, this is Bianca Martinez, and I'm going to be going over our assignment for week 6 for our Foundations of Nursing Practice class. So, for week 6, our assignment was to create our SBAR activity. There were 6 different scenarios to choose from, and I chose scenario 3, which is obstetrics, which is dealing with labor delivery. That's the area that I am possibly thinking of going into once I get my nursing degree. So let me begin by reading the scenario. Margie Colby is a 25-year-old parent, which is a first-time mother, is in recovery after low forceps delivery of a 9-pound, 2-ounce terminal. Although this was an unplanned pregnancy, Margie and her husband adjusted to the idea and are now very excited parents. Margie plans to breastfeed the baby. 45 minutes after delivery, Margie's vital signs are BP 100/60, pulse 88, and respiration 16. Her fundus, which is around where the uterus area on the stomach side, is at level of the umbilicus and no clots observed. She's had continuous trickle of bright red lochia, which is postpartum bleeding. There is no change to the perineal edema. Ice packs applied to the peripads change. The peripads and chuck weight indicate 300 cc's of blood loss from the first 45 minutes after delivery. 15 minutes later, the fundus is massaged and remains firm at umbilical level and midline. A constant trickle of bright red lochia persists and no blood clots expressed. The peripads and chucks weight showing an additional 200 cc's blood loss. Vital signs are now 90/52, pulse 110, and respiration 20. So with our patient being a first-time mom, she delivered a pretty good size, a pretty big baby for her first time, and the low forceps had to be used to help during the delivery. The main thing that first stood out to me was the blood loss. I know it's common to have some bleeding, but that amount just didn't sound normal to me before I decided to look more into doing the SBAR. So for starting the SBAR, the patient Margaret Colby, the first-time mom, has been in recovery for over an hour now of delivering her first baby. I'm going to be explaining all the signs and symptoms again. For the 45 minutes after, her vital signs were a little low. Her blood pressure was originally at 100/60, pulse at 88, and respirations at 16. So that kind of tells you that something has to be going on inside her. Her fundus did feel firm, but is at level of the umbilicus, and there's no indications of any blood clots. She was having night bleeding and was applied ice pack to the perineal area for the swelling she had, which is normal. I experienced that with my first child. But what they've noticed after changing her peripads and checking the weight, it was at 300 cc's blood loss. Once the 15 minutes after her fundus was massaged, the fundus still remains at umbilical level. Midline, she's still experiencing light bleeding with still no indications of any blood clots. But after her peripads were changed again and chucked, the weight was showing that 200 cc's of blood was lost, and her vital signs are starting to diminish even more. Her BP was now reading at 90/52, pulse 110, and respiration is at 20, meaning her pulse is really high, meaning that her heart is beating pretty quick for after an hour after delivering her first child, and respiration are at 20 now instead of 16 for what she started at, and she might be beginning to start having signs of difficulty breathing. For my assessment, I've noticed her vital signs have continued to decrease. The trickle of the light red lochia, which before can be normal, but now that these amounts have now totaled over 500 cc's in an hour, it seems to me that she is showing signs of postpartum hemorrhaging. After monitoring and just within that last, between the 45-minute mark and then those 15 minutes after, it is not normal to have, or in my opinion, it is not normal to have 2 more 100 cc's to be lost within that time frame. So my recommendation is that the doctor needs to come see this patient immediately because she is showing signs of postpartum hemorrhaging. My recommendation is starting the patient on medication and immediately continuing the uterine massages to help to stimulate contractions, which normally women, after you have your baby, you're still feeling your contractions going on. Some women ask for Tylenol to help ease with the pain. They're not as intense, but you still feel those contractions coming. And I would recommend the doctor examine the area where we've noticed the bleeding keeps coming from. My thoughts on the clinical scenario, which I luckily, with my 2 kids, I've never had experiences, but it is pretty common for women to have postpartum hemorrhaging, especially if the woman it's her first child. They had to use forceps, and with the baby being a pretty good sized baby at 9 pounds 2 ounces, she might have had more difficulty of trying to get him through her birthing canal. What I think could have been adding to the original SBAR is if they had already been giving her some kind of medication, especially for after they massaged her for to start up the uterine contractions. I would have documented that. I would have also checked and documented if she has had any complications throughout her pregnancy, and just if she was taking any medications before her pregnancy or during her pregnancy. If we did this conversation again, what should we do differently? I would, after looking through her medical record, I would see if she's had any complications before, any allergies. I would have monitored her closer once I saw that her blood pressure was low and they kept decreasing. I would immediately call the doctor, let him know what's going on, how much blood was lost. I don't think I would have waited that long. If 300 cc's in 45 minutes sounds like a pretty good amount to me that would be lost. It's normal to have some trickles, but when that trickle is 300 and almost 500 in an hour, that just doesn't sound. I wouldn't wait for the hour mark before I call the doctor. I probably would want to call him sooner and let him know that her blood pressure continued to drop. Her respirations is increasing to a higher number, that now they're at 20 per minute, and her pulse increased to 110. Do you think the significance of the situation was clearly presented to the physician? I personally don't think it was. It didn't seem as urgent being presented to the physician. As a new mom, it's scary to think that something is going on with you, because those thoughts of what's gonna happen with the baby, or is something terribly wrong with me, those ideas don't go through just anyone. That I would have waited the hour to call the doctor. Once I realized how low her blood pressure was, her pulse, I would have had another nurse come examine her just to do like that second reassurance before you call that doctor. But I still would not have waited that hour mark for that patient to lose 500 cc's of blood, had her blood pressure to again be 90/52 after an hour giving birth. Her pulse should not be 110, and especially For being 25 years old, your respiration should not be at 20. Yes, she's a young mother at 25, but being her first time mom, or just her age right, just she was healthy overall throughout her pregnancy or even before her pregnancy, those should not be her vital signs, meaning something is going on and you would want to catch the problem causing the hemorrhage before it is too late. So my recommendation is catching it sooner and not waiting an hour to call the doctor that you've noticed that hemorrhaging has been going on.